Hello, my name is Mark Reinhardt. I'm a licensed acupuncturist and have been in private practice for over 25 years. My clinic's name is Valley Acupuncture Center, located in Kent, Washington. I'd like to talk to you today about menopausal symptoms and their treatment by acupuncture. Menopause typically affects women between their mid-40s and mid-50s, with symptoms generally consisting of changes in their menstrual cycle, mood changes, hot flashes, night sweats, and skin and vaginal dryness. The specific set of symptoms depends on the individual, and symptoms can vary from very mild to severe. Acupuncture has indeed been shown to be able to treat many of the symptoms of menopause effectively, both by patient testimonials and controlled clinical trials. In my own clinical experience, this is indeed true. However, I have found that there are both things that limit acupuncture's effectiveness and ways to significantly increase acupuncture's effectiveness. The primary limiting factor is whether or not the patient still has their ovaries. If they have been both removed, relief by acupuncture will be difficult, and adjunctive therapies such as Chinese herbs, dietary changes, etc. become much more important, since artificial substitution of substances naturally produced by the ovaries is necessary. If only one ovary remains, then treatment generally will be slower and somewhat less effective. So if you have had them both removed, you probably will be happier with hormone replacement therapy than with acupuncture, unless you are unfortunate enough to have specific contraindications such as cancer. If, however, you are fortunate to have both your ovaries, you can expect significant and lasting relief within 1 or 2 weeks with acupuncture. That is, if the best treatment approach is utilized. When I first started my practice back in the early 90s, I was initially frustrated with the general effectiveness of treatments using point combinations and herbal remedies that I was taught or found in reference materials that were available to me. Results were often rather slow in coming, and not being satisfied with that, I palpated for other possible points that might prove helpful. Well, not only did I find that several of the traditional points were indeed tender, but I found an additional point that was quite tender, but was not listed in any of my reference materials. And when I included it in the treatment, I got much more rapid and complete relief of my patient's symptoms. Significant relief was usually obtained in 2 to 4 treatments, and that relief usually lasting weeks to months before any worsening or return of symptoms. Mild to moderate symptoms disappeared, and severe symptoms became mild. What a difference a single point can make. Of course, effective treatments don't consist of a single point. I found that the most consistently effective treatments consist of the new point, along with several of the more traditional points, supplemented with the appropriate points to treat the particular mood symptoms the patient may be experiencing. The most effective pace of treatment I have found is to have the first 2 treatments 2 to 3 days apart, and between the second and third 3 to 4 days apart. After that, the rule of thumb I use is if the treatment effect is holding between visits without backsliding, then you can extend the time between visits, going from once a week or twice a week to once a week to every other week, or until symptoms reappear or worsen again. In addition, herbal therapy is rarely needed, so no pills or teas are required. So if you're suffering from menopause symptoms and still have your ovaries, I encourage you to give acupuncture a try. You'll be glad you did. Thank you for your time. Bye.